There we go.
Hey, we're
Sorry,
in.
sorry about that. Don't know what that was on. You
That's
know
all
what that
right.
was?
You're
That's
right.
that's because my work phone's a Samsung and Android's terrible. And now I've got my personal one and it works fine.
Tut, tut.
I know. There we go. Thank you for bearing with us,
We're
everyone.
here. Thank you, guys. Thanks for having me.
Thanks for coming along. I think we've had this.
Right.
We've kind of been talking about doing something like this for a while, haven't we?
Ages.
And then everything blew up the other day, and so
Yeah.
it kind of worked out for us.
I know. You were like, so is it about time? I was like, yeah.
Yeah, yeah. Yeah. Now
Yeah,
it's
it is.
perfect actually. Yeah, now
Yeah.
works. Now works really well.
Perfect
Mm.
timing.
So I think it'll be interesting. I think I've not seen a live or any sort of debate like this really, where it's been kind of that mix of medic, non-medic, both in aesthetics, both from very different backgrounds, come together and kind of give our honest thoughts on what's happening.
Yeah, definitely. So should we do little
Go ahead.
intros?
Yeah, introduce yourself. I'm sure they all know who you are, but go
All
ahead
right,
anyway.
I'll go first. So anyone who doesn't know me, my name's Lindsay. I've been in the aesthetics industry for 8 years now, I think it is. Um, I'm non-medic, so I come from PMU background. So I started off doing lashes in my spare room, and then progressed on to doing PMU, so microblading, ombre brows, that sort of stuff. And then from there went into injectables, and that is
Nice,
me.
nice. And I'm obviously I've come from the medic background, so I um went to med school down in Nottingham, graduated about 10 years ago now, and started aesthetics pretty much straight away. Um, and have just kind of built up my business from there alongside the NHS role, which I still do a little bit.
Do you enjoy the NHS side?
Yeah, I do. I think
Yeah.
I think I still really enjoy it. I didn't enjoy it when I did it full time
Yeah.
because of the stress and the burnout with it. And I don't think, to be honest, I'd particularly be as keen on the aesthetic side if I was doing it as a full time thing. I think I quite like that I've got that mix and I can move away and do different things and come back.
Yeah. No, I get that. Yeah, definitely. No, I like that.
Um, so from the put this on silent. From the So the reason we wanted to do this is obviously because of because it's been a debate going on for ages, and me and you have our own private chats about that over Instagram and stuff, and kind of have our opinions on it. And I think it's everybody else seems to have an opinion now, so we may as well come out and give ours.
Yeah.
And as we discussed, whatever day it was, with everyone on this chat, I'm sure has seen a certain video, which we won't go into too much details about, but that kind of is what prompted us to go, actually, this isn't okay anymore.
Yeah.
Let's get together and see what the thoughts are out there. Um, so, what things have you kind of experienced then? So from your non-medic background, what have you had any issues, especially maybe when you started out, or um, more recently, have you had any experiences where people have maybe asked you if you're a nurse, what did you be a nurse or a doctor, not been happy about it? Have you not found there's any issues? Have you had any issues with training because you're a non-medic?
Yeah. So when I started, because I started 8 years ago, there wasn't really many people doing it. So I think I was quite lucky when I got in. There was only one person doing like fillers and Botox near me at the time. And she's a nurse, and I am still good friends with her still to this day. She's lovely. But I didn't compete or anything. And when I started, because there was like no one doing it, there wasn't this medic non-medic thing. Well, I never experienced it anyway, because there was no one to argue with. There was no one doing it. But I found more so over like when COVID hit, maybe because everyone's on their phones more and there's more I don't know, but I found around 2020 that's when I started to really notice
Hmm.
like quite a big clash in people. um I've never had anyone sort of personally put me down or attack me for being a non-medic, but I have had situations where being a non-medic has sort of left me on the back burner a little bit.
Hmm.
So like I mentioned to you earlier, I had So just for anyone who's watching, I'll just give you a bit of brief. I'm not going to go into like full detail, but I had a lady message me last week from a filler company, and she was contacting me on the back of my cleft lip videos. So I've started offering cleft lips for free for first time clients and stuff like that. And she said, oh, you know, we've been following you for ages. We really like your work. We're really inspired. We want to be able to support you. We want to be able to like gift you filler to be able to do these free treatments for these clients. And I was like, amazing. Anyway, she came in today. And long story short, unfortunately, the filler that they sell is for medics only. So it was a bit of an awkward conversation because you could tell she really wanted to like get me on board, but she was like, oh, the company, it is medic only, so I think this is going to be a bit of a barrier. So then I was like, there's nothing I can do about that. So that's how it's sort of been left. But there are companies out there, like, is it Galderma, that have gone medic only now?
Have
So
they?
like, yeah,
I know there are some pharmacies that are out there that are medic only.
I think it is because of, am I saying that right? Galderma, am I saying
Galderma.
that?
Yeah,
Is
yeah,
that
yeah.
right? Yeah,
Yeah.
because they've
That
gone
that'd
medic only.
that'd make sense actually, because it's one of the pharmacies I'm thinking of is MedFX, and they're medic only, and they're affiliated with Galderma, so that may be why. And I
Oh.
think that's a problem because I do some prescribing for people
Mm.
who are non-medics, and I'm like, well, I'm doing the prescription. I've approved
Yeah,
this person to be able to carry out these procedures. Why would you not
yeah.
uh, let me order it? But yeah, certain places are, and yeah, I don't get it. So my opinion on this has always been, I've been very clear about this. I've commented on loads of your stuff about it. And I've said to other people a lot of the time, I don't think there's a particular need for someone to be a medic, to be a doctor or a nurse. I think as much as it may be, I may say this wrong and put this across in the wrong way, but I think I did, an undergrad degree. I did my medical degree. I've then done my postgraduate exams. I've done my surgical training. I've done a lot of uh, anatomy, physiology, pharmacology for 15, 18 years, something like that, since I started uni. So I probably have got, maybe not from a lot of people, but from for the majority of people out there doing aesthetic, my knowledge of anatomy, physiology, pharmacology, all the rest of it probably is higher than theirs.
Yeah.
But that doesn't mean that you have to be a doctor or a nurse to do it. I think if you've hit the minimum standard,
Mm.
which is your level, whatever anatomy, physiology, yes, you might have a medic who knows a bit more, or what, but it doesn't matter. If you've hit that minimum standard, going beyond that shouldn't make a difference. So if you prove yourself as hitting that minimum standard, that should be enough.
Mm.
If you've then, carried out your anatomy, physiology training, your Botox training, your dermal fillers, and you've actually done things to a high standard, it shouldn't matter whether you're a medic by background or not, if we've
Yeah.
all done the same training to be able to do that. I mean, I don't, as a doctor, yeah, you prescribe. You very rarely, if any nurses are on this call, by the way, they'll say this. Doctors in the hospital very rarely administer any medications. So in terms of
Mm.
injections, it's usually the nurses who give them. We prescribe them, nurses give them. So
Yeah.
we're not particularly, and me, I mean, probably did I mention this at the start, I'm obs and gynae by training. Yes, I'm a surgeon. Yes, I do. The surgical exams cover everything, but
Yeah.
that's very different. So it's, there's no real reason. So that's where I stand on it.
Mm.
Um,
It is hard because who was it? I was talking to someone and I can't remember where it stemmed from, but people were talking about the doctors thing and all of this. And I said, if I was going to argue for the medic team, I would say dentists are more, they've got more like
yeah,
anatomy, like, because they literally learn. Like, I think it's really bad that it's like all medics are grouped together and non-medics are grouped
yeah,
together because everyone's different. But like you say, you could have a midwife and a
yeah,
dentist. Well, one of them is going to have a million times more
yeah.
facial anatomy than the other,
The
but the
de-
class is the same.
the dentists spend like 5 years doing everything from the neck up, and we spend 5 years doing everything else and a bit of the head. So
Yeah,
yeah, it's no different. Now I think one of my real sort of bugbears with it is I think the the whole issue here comes down to the training. I think
yeah,
the reason we have the issues is that the training is, we're going about, they bang on about regulation, throw regulation out there as just a word. I
mm,
think the regulation bit, fine, do what you want there and argue that and debate it all you want. But actually, I think the issue here is the training. There's no standardised training, and I work at the University of Nottingham as well, and I work in their assessment team, kind of supporting the students through their exams. And if you're assessing somebody, first of all, if you train somebody, it's very difficult to train and then independently assess them without being biased, especially if
Yeah.
they paid you to come on a course.
Mm.
If you're then assessing somebody, it's got to be a standard. So across the universities, there's all, we have somebody from, say, Leicester come to us to check that our assessments are of the same standard and quality as Leicester's are, and then Leicester are the same. So we all
Yeah.
know we're assessing fairly similarly. Whereas when I started doing my training, I realised that actually that doesn't matter. There's no standard
No.
of like, when I first started out, I had to do a certain number of cesarean sections in theatre before, under supervision, before I was allowed to be let loose and do my own thing. And
Yeah.
every single obs and gynae trainee has to do that. Whereas in aesthetics, you got some courses, you'll do 10 lots of Botox, you'll have follow-ups, you'll come back for shadowing days. You got other courses, well, you do the frown, you do the forehead,
Yeah.
you do that crow's foot, you do that crow's foot, here's your certificates, off you go, start your own academy.
Oh,
It's
it's so
bizarre.
bad. My beginners training was horrendous, but I had nothing to compare it to. And I did fillers in about 3 hours. I had no
Yeah.
theory, nothing. I literally went into this little salon and there was people everywhere and I sort of stuck the needle in. And like you say, I did half of a lip,
Yeah.
she did the other half. And I went home with a certificate and I was like, what on
Yeah.
earth? But then so I started training in beginners. I think I did it for like 6 months and then I went on to do my level 7 and I did mine with A training. And have you ever been there?
No.
Oh my God. Like anyone who's been to A training will know what I'm talking about when I say this. You will never go anywhere else for training after you've been there because it is like a little mini college. It's like a little
Yeah.
mini training thing. But
Yeah.
they've got classes, they've got prescribers on site. When I say everything is done so structurally, and they've got teaching assessors, they've got IQAs, EQAs, and they've got the steps to oversee that person and that person oversees that person. And when I come out of there from my training, I remember and I rang my staff and I said, we're not offering beginners training anymore. They were like, why? I was like, because I can't compare to that. That's how you should be taught. That was insane.
Yeah.
So it
Yeah.
just goes to show. And I scrapped it because I was like, no.
It's difficult though, isn't it? Because if you're offering, like I try and do, I'm moving a lot of mine to, I still do beginners. I'm moving a lot of mine to online, so a lot of the theory is going to be done well before. Because I've
Mm,
tried, trying to get it done in a day or so, you can't do it,
yeah,
and
it's hard.
so I do that. And but then if you offer, I could do you a comprehensive training package where you'll come and learn how to do toxins properly, and it'll take X number of days, and then you'll have to come back after so many days, and we'll do a portfolio where you can do some treatments independently, come back and
Mm,
I'll look. No one wants it because they want to come in and just do the training and leave a lot of the time
yeah,
until they do that and then get to the other side and go, I haven't got a clue what I'm doing.
yeah.
Um,
It was
so yeah,
only
I
like,
think that's
I swear it was like, I'd say I'd been doing Botox probably 3 or 4 years before the penny dropped for me because I was taught a basic, the grid map and you do this. I didn't have a clue about what I was doing. I was just sort of like, oh, well, the frown, I was taught to do that. Oh, and the forehead, I was taught to do that. And then it was almost like one day someone just flicked a light switch on and I was like, oh my God, I get it now.
yeah.
But even that, I think Botox seems like a really easy thing for people. And I think here, yeah. But in my subscription, I talk about lower face Botox quite a lot
Mm.
because I see the most, you call it a complication, maybe, yeah, it is a complication, not like life or death, but if you're injecting somewhere lower
Yeah.
face and it either migrates or you're too deep, and I see it all of the time. And 9 times out of 10, when I see it, I think it's just like it's so avoidable
Yeah.
because they've
Yeah.
just not been taught properly.
No, and I think that's where it comes. You try and cram it all into one day. Like I say, I'll have my online training package, and they basically can take their time going through that to
Mm,
learn all the anatomy, physiology, theory behind it. Whether medics, non-medics, take their time, and actually then in the future, whenever they've got through that, they can come in and do the practical day. And then the whole
yeah,
day is basically just saying, right, let's get the mannequins out, let's use the mannequins. Right, you're happy now, right? Let's move on to real people, and they'll just run a clinic, and they'll just do a clinic of it. And then I've had people come back for shadowing days after to reinforce that. So it's good, and I think actually that's probably where my opinion is the regulation needs to be started there. It needs to be a standardized training program that's independently checked against everybody else. So whether you go for a training program by a non-medic in Southampton, or you go up to Glasgow to a medic or whatever, the
Yeah.
course is standardized. The amount of patients you need or clients you need to inject is the same.
Yeah.
The course content is the same, and the assessment is the same.
Yeah. I
That's
completely agree.
And then it won't matter whether you're a medic background or a non-medic because you've all been assessed at the same standard.
Yeah. I think it's so bad. Like when I see the courses now, and you know what I'm talking about, like the sponsored ones, you'll be scrolling through and it will say 20 or 30 certificates for 500 quid. And I think,
Or
like,
the Instagram post,
yeah,
like, this person came up to train with me today, like 7 certificates in their hand. Come on.
honestly, but that I'll look through and I'm trying to work it out because I'm really black and white and I'm looking through the list and it will say like Botox, this and that. And I'm thinking the Botox actual bottles would cost more than the whole entire
Yeah,
course. How is this happening?
yeah,
What?
yeah.
It's so
That's
scary.
honestly, the prices are a completely different debate, and maybe we need to set something up for that conversation as well, because that's bizarre.
Yeah,
When they can buy the stuff cheaper than I can do it with a prescription, you go, that doesn't make
no,
sense. But anyway,
red flag.
I
Yeah.
think the other thing they've discussed, and I do want to go at the start. We mentioned about this when all the sort of bitchiness started in around COVID time. I want to come back to that in a minute, but another thing there's a lot of discussion around at the moment is whether we should be looking at, this idea of medical oversight. And I've also heard medical oversight with ultrasound. And I've
Yeah.
also heard the idea of this tiered system of, if you're a non-medic, you can do a certain treatment, but if you're a medic, you can do another sort of treatment.
Yeah.
Um, have you heard that, and what are your thoughts?
Yeah. Do you know what? I'm on the fence. And yes, I am non-medic and I should be batting for the non-medic team. But again, it's like you say, I see bad on both sides. And sometimes I see these things like the BBL thing, for example, the bloody chin liposuction with what was it, a phlegm machine.
Yeah,
And I see these things and I think, no wonder that we have this thing because what, like, that to me isn't a medic non-medic thing. That's a stupid, zero common sense, greedy thing.
yeah.
And it's just stupid.
Did you, or I guess any of the guys in this chat, actually see that video recently, the liposuction where the undercover reporter went in? It's going around somewhere online. She basically went in and did this course as a reporter. They basically were doing liposuction in the back room of a nail salon. And because she didn't want to do it, because she's a reporter, she made an excuse, said, "Oh, sorry, my kid's ill from school. I'm going to have to go and pick them up." And the
Mm,
person training said, "Oh, don't worry. You've come anyway. I'll give you a certificate."
awful.
Man, if you've not seen it, have a look for it online. Um, yeah, I don't see. I've seen terrible. That's the thing. I've seen terrible medics, and I've seen really good non-medics.
Mm,
And so I don't think that makes a difference. And I think actually having medical oversight. I mean, for you, me and you started around the same time, and like you said,
yeah.
there wasn't that many people doing it. So the chance of if you had to have medical oversight, chances are you'd have somebody with far less experience than you in your clinic
I said,
giving you your
come and
experience.
watch me.
Yeah. Um, and yeah, I think there's some sort of collaboration to be done around kind of, like I've got an ultrasound machine. I like
Mm,
having the ultrasound machine because I scan. I think people who maybe don't scan, I scan at the hospital, so I'm used to it. If you don't, it's probably a difficult thing to kind of get your head
yeah.
around. So maybe there's some sort of collaboration where actually I partner up with this person who's a medic or non-medic but scans and
Mm,
can deal with complications, and they're within a certain radius of me and can see you within 24 hours. That probably makes sense from a safety
yeah.
point of view. Um, but having somebody you have to pay to come and sit in your clinic anytime you want to give someone Botox seems a bit daft.
Yeah. I think when I read it, like the consultation, when they said you're going to have clinical oversight, automatically I was like, oh, well, we'll have that anyway. They're talking about like prescribers with stuff. But
Yeah.
then people were saying, no, like on site 24/7, like as you're doing treatments. And I was thinking, how would that even work? Are there that many people? There's not enough people to be able to do that.
No, it's difficult enough to get your prescriber to come and see your clients, never mind
Yeah.
sit there just twiddling the thumbs while you're doing stuff.
Yeah. I just
Um,
thought that would never ever work. Ever.
no, no, I don't think so. And I don't know who they're consulting with when they're having these conversations about how they are going to regulate it, but I don't think
No.
this is the way to do it. Um, yeah, I wanted to go back because I meant to say this earlier. The thing around sort of COVID time when it all kind of started kicking off, I don't know if that corresponded with like more people in the industry, therefore more competition, therefore everyone started having a go at each other. For years,
Mm,
I've just stayed in the background. I've done my clinics. I've not been particularly active on social media. I've kept my head down. I've done my clinics. I've enjoyed it, but I've stayed well away from it because it has become such a bitchy little backstabby industry at times, and I really
Yeah.
don't like it. And that's not just. I mean, that video did go extreme, but that's not just medic versus non-medic. That can be two non-medics, two medics. It's just not nice sometimes. I don't know why it's like that.
It's not nice. And I found, like, from a medic point of view, I was shocked when I watched that because I saw it come up and I thought it was going to be the medic non-medic thing, and I thought, oh, boring. And then when I saw that it was doctors only, I thought, oh, is that a publicity stunt?
Mm, yeah, I'm
It,
not sure what the plan was
yeah, no,
there.
I don't think it is. But I was just like, oh, you've pissed a lot of people off
Yeah,
there.
I can see the right. So to play devil's advocate, I can see the argument because of countries like Australia, other
Yeah,
places. Um, but it makes it incredibly expensive as well. Like I have a woman who flies to me from France because it's cheaper to fly from France for a treatment and fly back the next day than it is to have it done in France because it's so expensive there. So I think there's it's not of any benefit, I don't think. And I think actually it is, again, it just comes down to the training, doesn't it? If you train properly, it doesn't matter whether you're a doctor or not. And
yeah,
actually, people who are non-medic, they work closely with medic. If you're a prescriber, we've all heard the rumours that, we all know there's prescribers out there. You just text them the name and date of birth and they'll prescribe for you.
yeah.
Um, and if you work like that, that's dangerous. But if you've got a good relationship with your prescriber, people I prescribe for will message me. I've had this happen. What do you think? Can you have a consultation with this person? Oh, I've had a chat with them. They've got this. They want to ask some questions. Do you mind
That's
chatting to them? What?
good.
And I think that should be that prescriber, medic, non-medic kind of link as well. That
Yeah,
there's that
because
support there as well.
this is another thing that I thought about, because the remote prescribing thing. People say, oh, can you do it? Can't you do it? And I've said, well, it's a grey area. People do whatever they want at the end of the day. But what about companies like Faces, who
Yeah, yeah.
I don't know whether they
That's
do it now. I haven't used them for ages, but
I
they
find.
were years and years was all remote prescribing.
I think I'm sure that's going to change. I find that very odd because I think if you sat in a GP practice and somebody rings up now and goes, "I think I've got a water infection," they won't dip your weave. They just go, "Okay, I'll send some antibiotics to Boots for you. Go and pick them up."
Yeah,
Like that surely needs more face to face than going, are pregnant, breastfeeding, do you want some Botox? Like that
100%.
kind of.
Yeah, yeah, yeah.
Um,
It's really, really.
hmm,
When people ask me questions, I'm like, I see it from both sides, and I
yeah,
understand why you would think this, and I understand why you think that. It literally just needs, right, what's the answer to that? What can I do? This. It needs structured, yes or no, black and white. And there's
yeah.
none of that at the minute.
No, nobody wants to stick to it. I've got with my conspiracy theory tinfoil hat on. I kind of go, is it because they kind of going, we want to regulate it, but we don't, and if we do it, then we lose the 20% VAT that all the non-medics are paying on the fillers. Um, I don't know. I don't know what the argument is for it. It's mental.
I think it's a mixture of everything, and I think it will mess up the NHS even more than it is already. Because let's face it, if I was a nurse or a doctor and they said, right, it's medic only, I'd go,
Yeah,
lovely job.
yeah,
I'm
yeah,
gonna go
yeah.
out and open my
Off
own
I go.
clinic.
Off I go.
Yeah.
Yeah, uh,
They've like tax. I don't know. I said that most of the industry is non-medic, isn't it?
yeah.
So think if they said, "Oh, it's medic only now," or they made it extremely hard to be there, they would lose all of that money in tax,
Mhm.
VAT, all of that. And it's sad, but I just think the government's too greedy. I
Yeah,
don't
yeah.
really think they care.
Yeah, no, no. It's
They're
too
too
late now. It's
greedy.
already out there. Everyone's doing it. It's out there. I just think you make it safe, and I think what's going to happen is, honestly, I believe this regulation that they're talking about now is going to be um, like tattoo parlors. They'll come in every now and again. They'll do a spot check, make sure you've got a sink and a sharp spin. That's not regulation. That's just additional costs for practitioners, and especially if you're starting up
Yeah.
in a really competitive environment, you don't need an additional few hundred quid a year to have to pay for a local council person to come around and just check that you're washing your hands.
Yeah, it's silly. And again, all the councils all have their own rules.
Mm.
Because when I was doing PMU in Southend, I wasn't even aware of the council stuff. And when I went to get a license, she come round and I was in a tiny little box room. I had carpet. I didn't have a sink in the room because I was none the wiser. And she had a little clipboard and she went, yeah, you're going to change your flooring, aren't you? You're going to put something hard down and washable, aren't you? And she's going like this, and I was going, and she was like, oh, that sink in the bathroom over there, that bathroom, you don't use that for anything else other than your PMU work, do you? And I was like, and she signed me off
Yeah,
and left.
yeah,
But Other
It's
places, when I moved to Bexley, which is classed as a London borough, oh my God, that no, they were
mm,
hard as concrete. They wouldn't crack over anything.
yeah,
So again, they've all got to have they've got all stick to something
yeah,
because councils all have their own rules.
yeah, yeah. I think you're right. I think we've kind of realised that it's all regulation and standardisation, isn't it? But
Mm,
um, one thing I just wanted to say before I don't know if you saw this, and it's just sort of a little tangent, but just before we kind of summarise uh, and kind of make some sort of conclusion after of all these things
yeah.
we've said. Did you see on I think it was on your thread actually, that um, it kind of started going a bit toxic towards the medics, towards the bottom of the chat, where people were saying, well, actually, I don't think medics should be doing Botox and fillers
Uh?
because all these queues at A&E, that's because all the doctors are out there doing Botox instead of being in
Oh, I
A&E
did
looking
see that.
and I don't get involved in it, but that was one where I was very close to comment, and I'm just like, I did a 12-hour shift on Sunday on labour ward. Like, I'm there doing it. And I think most medics, there's few medics who are actually doing it full time. I think most medics are doing a bit of both. But yeah, I saw that, and I just think that's what kind of prompted me. Actually, it was that bit that made me go, I need to speak to you because actually, what's getting worse and worse and worse is this divide between everybody.
It's causing
And
that divide, isn't
yeah,
it?
I was recording a podcast with someone today, and the whole chat there we were saying, it's the way you get past all this division and all this anger and nastiness online is to just kind of be a little bit more inclusive and kind of work together.
Mm,
There's trainers out there, famous trainers who you'll have all seen, probably follow on Instagram, who um, basically spend most of the time, from what I can see, slagging off non-medics, saying non-medics shouldn't be able to do it because they're not trained properly, and then
mm.
exclude non-medics from his own training. Why do you do that? It's, that sort of thing
Silly.
needs to stop. The thing about, nobody works together, no one shares information. If you try something new or you develop something new, you've started using a cannula for a certain treatment or whatever, or better not
Mm,
tell anybody because no, like share information. I've done this worked really well
yeah.
for me, that worked really well for me. Whether it's with medics, non-medics, share that, help each other out. Stop. I work in a building where there's about 4 or 5 of us who do aesthetics. I think me, a nurse, I think the others are non-medics. But like, if I've got a complication or something, I'll say, oh, one of the girls I work with is Sophie. I'll say, Sophie, she's a non-medic, but she's really good at what she does. And I'll go, Sophie, will you just have a look at this picture? This person sent me this. I think it's just a bit of post-procedure swelling, but what do you think?
Oh,
And it's nice to have that.
100%. It's always better to get someone else's opinion, like
Yeah.
100, because you're never going to be right 100% of the time, and sometimes
No.
you do just need that little bit of, oh, I think this is it, but like, what do you think?
Yeah.
It's
Yeah.
it's so,
And
so
yeah,
important. It's so important.
I think there's a lot of that that needs to be done. I think if we can I think everyone on this chat, hopefully, I've not seen all the comments coming in. Maybe they're all disagreeing with
I
me.
actually
But
haven't. It's that mine's come down, so I haven't seen. I can only see like the last couple of lines.
but I think if we're all kind of in agreement, this is a good start. There's sort of 200 people on this live now. Like
Mm.
hopefully this is kind of breaking down some barriers a little bit to make people go, actually, you know what? It doesn't have to be this horrible everyone out for themselves and against everybody else.
No.
We can all kind of work together with this.
Yeah,
So,
we all need to work
mm,
collaboratively because you never know, regardless of your background and how long you've been doing it. Oh, Mark's just jumped on. Hi, Mark. So it doesn't matter how long you've been doing it. At some point, you will need help, and I will just clarify that really, really quickly. So I don't know if you saw it or if anyone else saw it when I was in my Bexley clinic. I think it was 2 years ago. Um, one of the girls who worked with me, she did a nose, and it was on a Saturday, and I don't work Saturdays. I was at home, and she did the tip lift, just
yeah,
point one, and she'd been doing fillers as long as me. I'd trust her with my life. Aspirated for 10 seconds. She's like religious, whereas me, I'm like free that, she's like 10
yeah,
holding it like I'm waiting. So she messaged me a picture, and it was this, the girl was on the bed and her whole nose here and all the way up here, it was like someone just turned the blood off, and it was ice
mm,
white. And I messaged her back straight away. I said, oh my God, how many vials did that take? She went, oh no, I just put a bit of heat on and it went away. And in my head I was thinking, oh, maybe I would have done that with lips or anywhere else, but I wouldn't have risked a nose. Anyway, about a few days later, even though the girl was fine there and then, she kept her in the clinic, she was fine. 3 or 4 days later, she started getting pustules.
mm,
And we ended up, it took me about 3 or 4 days of injecting. I think I got to day 3 of where I was injecting, and by this point, obviously, ultrasound. I hadn't had ultrasound by then, and it moved, and I'm dissolving nose. I went to her lips. I done her chin,
Yeah.
and I was going around. But obviously, as the days are going on, the filler's moving as I'm going like this. And there's a guy near me, literally where my shop was. He was like on the same road. He is, oh, what is he called? Eclipse, Adam at Eclipse. And I knew he had an ultrasound, and I messaged him and I said, Adam, I've been doing this for 3 days. Please, can I pop in and use your ultrasound machine? And he said, yeah, that's fine, come in. And he got the machine on, and I think he spotted it within like 5 minutes.
Yeah. It makes a huge difference,
Huge,
doesn't it? The
huge
ultrasound machine's
difference.
great. If anybody, well, we're on that actually. If anybody's, I'm based sort of Manchester, Warrington, Cheshire area. If anybody on here is around there or knows of it, if you ever struggle and need access to an ultrasound machine, just drop me a message, because I've always got it with me, and we can always have a little look and see what's going on if you're struggling to manage a VO on your own.
Yeah. I think it is important. I was always on the fence, not cocky, but I was like, oh, I know how to dissolve. I know where the arteries are. If something needs doing, I'll do it. And I remember being on day 3, and the girl, bless her, she was such a good sport. She was like, it is going to come out, innit? And I went, babe, I am adamant it's
Yeah,
coming out.
yeah,
When? I don't know.
yeah.
We're
It
three
will.
days in.
Yeah.
Bless her.
It,
But yeah, we did 13 vial. I think I did like 11 or something in my clinic. And then I got her in the car, took my emergency kit to Adam. He got the machine out, and he said, and he found it here in the end. So obviously it travelled from
yeah,
here down to the lip and across and back
yeah,
up, and I was just chasing it.
yeah, yeah.
So
That's
I
why the
think,
ultrasound makes a difference.
yes, yeah, anyone who's thinking, oh, they're expensive, I don't want to get one, like, they are so invaluable.
You got the same one as me?
No, do you know what? I've just got a little cheap one. But I always say
Oh,
to
no, yeah,
everyone,
good.
don't
Whichever.
get a cheap one. Yeah, but the thing is, when you like, oh, what have you got?
Yeah,
Ultra X. So that comes with training.
yeah,
And people in my subscription always say, Linz, where'd you get your ultrasound from? And I'm like, just get an Ultra X, because it comes with training. Because when I bought mine, yes, it's an ultrasound machine, it does the same job. I didn't have a clue how to use it.
no.
And I had to go into like neurodivergent mode, where I was on YouTube and that for about 3 weeks trying to like
Yeah,
research how to use
yeah.
it. It's just not worth it.
I'll do a course one day on it online, because then people who get it, they can kind of log on and have a
You
look. It's not the
should. That's
hardest thing in
such a
the
good
world.
idea.
I do scan in the hospital, so it'd be quite easy to put together. And I think then
Mm,
people, if get it, even when they get it, they can kind of always go back and look at that. But yeah, yeah, I think the ultrasound's massive. And I wasn't, if we've mentioned ultrasound, just because you saw Mark before, I just wanted to, a nice little plug for Mark if he's still on here. Mark owns Smile Pharma, by
yeah.
the way. So if you're based in Warrington or not based in Warrington, um, definitely have a look at Smile Pharma. It's a great pharmacy, really, really good. And if you're based near Warrington, you can pick it up the same day as well.
Yeah.
I
Do you
think
know
he's
what? That's
probably
the
got.
one thing I hate. Where are you based? Are you up
Yeah,
north?
yeah,
That's the
yeah.
one thing I hate about being down south. All the exciting stuff's up north. We haven't got anything down here. All the pharmacies are up there.
Yeah,
We've got
yeah.
nothing.
It's a great one. Um, right then. Well, I think what we've kind of, I mean, from my point of view, I think it's clear that we understand there's this argument with medics versus non-medics, and I kind of get where
Yeah.
it's come from, and I don't know who's starting it or who's propagating it or what the issues are. I think there are issues with training. I think we both agree with that. I think training needs standardization.
Yeah.
But I think the overarching theme from this is that everyone just needs to work together a little bit more, don't they?
Yeah. And I think I just want to say a massive appreciation for you as well. And I know a lot of people agree with me on this, because obviously from a medic point of view, it takes a lot for you to sort of not accept, but like basically accept the non-medic community and stand up. Because if every single medic said, oh yeah, no, let's go medic, it probably would have gone that way. But people like you who are pushing and promoting for like us, it makes a massive, massive
Yeah.
difference. So I know on behalf of everyone in the comments, we all say thank you.
Absolutely fine, not a problem. No one can ask anybody to give you a real reason why it shouldn't be medic, why it should be not, medic only. But
Yeah.
I've never heard anybody give me a reasonable explanation as to why non-medics. Oh, well, because, it should be doctors. Why? Well, in other countries, it's doctors. That's not a reason. Why? Ask someone,
Yeah.
keep asking.
Explain.
Nobody can tell you.
No.
So until somebody can give me a good reason for it, then I don't understand it.
If they ever do, let me know, because I'd be interested to know.
Right. Well, thank you very much for taking up your time and joining me on here.
You're
Thank
welcome.
you to
Thank
everybody
you.
else who came along. Yeah, I hope it's been useful for you all.
Yeah. Any questions, just DM either one of
Yeah.
us and we'll be happy to answer.
Yeah.
But yeah, it was good chatting to you. Thanks
Yeah.
everyone for joining.
I'll post this and I'll post it on the grid and share it with you.
Oh yeah, yeah.
And if anyone wants to ask any questions as well, they could pop it on there.
Pop it in there.
Yeah.
Amazing. All right, thank
All
you.
right. Sorted.
All right.
Thank you, everybody.
See you later,
Bye.
guys. Bye.